All right, you guys, so last bit, we're going to talk about some respiratory problems. All right, so hypoxia, right? So hypoxia simply is oxygen deficiency at the tissue level, and depending on how that happens, it's classified in different ways. So for example, hypoxic hypoxia is caused by low partial pressures of oxygen in arterial blood. So common things that would cause that: high altitude, airway obstruction, right, or fluid in the lungs. So any of those things that are caused by low partial pressure of oxygen in the arterial blood. Okay, and obviously the severity can vary. Anemic hypoxia, so basically not enough oxygen or oxygen deficiency at the tissue level because you do not have enough functioning hemoglobin in the blood. So most common would be the anemic kind. You just don't have enough red blood cells, or you can have it due to a hemorrhage, or your hemoglobin is not functioning because you have carbon monoxide poisoning. Carbon monoxide has attached itself to the hemoglobin and is not giving up those binding sites on the heme to the oxygen. So again, you're not being able to transport it to the tissue level. There's stagnant hypoxia, and basically this is due to the inability of blood to carry oxygen to tissues fast enough to sustain their needs. So basically it's stagnant, like it's pooling, it's not moving quick enough. So heart failure, right? Heart's not circulating blood, it just kind of sits there. That's a problem. Or some type of circulatory shock where your blood vessels all dilate, and again, like your blood pressure drops too low, so you're not moving blood through the tissues and blood vessels fast enough. And there's histotoxic hypoxia. So blood delivery is adequate, but the tissues are not able to use it. Okay, so again, now you're getting it there. Everything there is fine, but there's something wrong at the tissue level. So for example, cyanide poisoning works this way. If you remember back to aerobic respiration, do you remember the electron transport chain in aerobic respiration vaguely? It goes after the Krebs cycle. In that electron transport chain, you have something called cytochrome C and cytochrome Q. Basically, cyanide poisoning prevents those little cytochromes from moving, shuttling the electron back and forth. That shuts down the entire process, and you die very quickly, as a matter of fact. That's histotoxic hypoxia. Tissue cannot use the oxygen. So carbon monoxide poisoning, we mentioned this a couple times now. So carbon monoxide can be found in things like car exhaust, tobacco smoke. Okay, it binds to the hemoglobin more successfully and about 210 times as tightly as oxygen. So once it's bound, it is very difficult to have carbon monoxide removed. So you often hear about this in Arizona, where people are out on one of the lakes and they've got a whole bunch of boats running, they're all kind of partying, and they just kind of pass out into the water and then they drown. This is because of all the carbon monoxide and the exhaust coming off the boats. You have plenty of oxygen, you're outdoors, how much more oxygen can you get? But because carbon monoxide binds to it so tightly, even just atmospheric oxygen is not enough to counteract how tightly oxygen or carbon monoxide will bind to the heme. Okay, and so if we take a look at like smokers versus non-smokers, at any given point in time, in non-smokers, less than 1.5% of the hemoglobin has carbon monoxide on it, and it can get up higher in polluted cities, but it can get up to 10% in smokers. So it's part of the reason why smokers are often winded, right? They have a hard time catching their breath. The atmospheric concentration of 0.1% is enough to bind half of the hemoglobin. Okay, so it doesn't take very much. 0.5% in the atmosphere is enough to bind half the hemoglobin in your body. So like if you're running a car in a closed garage, that's a very bad idea. Okay, and we treat this by administering pure oxygen or oxygen in a hyperbaric chamber. Okay, smokers, again, they're easily winded. Part of that is going to be that carbon monoxide. The nicotine also constricts those terminal bronchioles. So those bronchioles are constricted, air can't get to the alveoli, you have a decrease in gas exchange. The there are many things in the smoke that's going to cause excess mucus to be secreted, more mucus, again, decrease in oxygen exchange. Okay. The cilia in different, like in the pseudostratified cilia columnar epithelium, it causes them to stop moving, which again causes mucus buildup to occur. If you remember back to that picture of the alveoli, we saw that there were elastic fibers as well as reticular fibers, but elastic fibers as well around the simple squamous epithelium that helps the alveolus kind of spring back from being stretched. When that wears out, it destroys the alveolar air sacs and leads to emphysema. Okay, so in emphysema, basically you have those individual air sacs, they lose their elasticity, and they become like one big air sac, so the surface area is greatly decreased. And that, of course, is going to affect gas exchange. You may have heard of COPD, or chronic obstructive pulmonary disease. So really, it's a group of lung diseases that block air and make it difficult to breathe. It's very common. Emphysema, chronic bronchitis, damage to the lungs from COPD cannot be reversed. So here you're seeing in this image chronic bronchitis, healthy bronchioles. This is what happens. Excessive mucus, like all that goopy mucus, they're inflamed. So again, the airways are constricted. And here you're seeing emphysema. So here's normal alveolar air sacs, and then in emphysema, the membranes are broken down. So again, we're losing lots of surface area for gas exchange. Okay. And here's, I'm sure we all know what asthma is, right? It's a condition where a person's airways becomes inflamed, narrow, and swell. They produce extra mucus, and it's very difficult to breathe. Again, very common. So here's a normal bronchiole. Here's an asthmatic one. Right? Remember, there's smooth muscle, and you can see the smooth muscle actually constricting, making the diameter much narrower. Right? Again, difficulty breathing. People will say it's like breathing through a straw. That's what it feels like. And obviously, it's kind of very suffocating. Can even be a very panicky feeling. Okay. And then you have something called pneumothorax. That chest cavity is sealed and it's not open to the outside. But when you do end up puncturing the chest wall, what you can kind of see here, here's the lung on, take a quick look. Well, we'll just call this the left side. You can see let me take that back. Right side, there's an R right there. So here's the right side. You can see the lung filling up the entire pleural cavity. Here, can you see there's been a hole here? So a hole's been poked through the rib cage, letting air into the pleural cavity, which causes this side, the lung, to deflate. So basically, this individual is only getting air exchanged in the right side, right lung, not the left. So that's called a pneumothorax. Okay, when you have some sort of damage to the chest cavity that allows air to come in and causing the lung to collapse. Okay. All right. And that's it. Woohoo! For respiratory system. Yay. So as always, please let me know if you happen to have any questions. I'm more than happy to help, and I will see you guys next time.